I'm Andrew Geddert. I've been practicing as an herbalist, as an expert in immune and digestive health for 35 years. And today we're going to talk about the difference between a long COVID clinic and a natural medicine clinic. Well, recently I read a book about long COVID, and it's written by a psychologist who works in a long COVID clinic. And he believes that everybody with long COVID should go into a long COVID clinic. Now, my experience in the San Francisco Bay Area is totally different. When my friends and colleagues call the long COVID clinic, they're told there's about a 3 to 6 month waiting period. There's also insurance issues because many insurance companies are not paying for long COVID because the diagnostic criteria is sort of up in the air. And then finally, unless you live in a major metropolitan area, the long COVID clinic might be 5 or 6 or 7 hours away. And that's a terrible thing to undergo if you have a chronic illness like long COVID. Now, the reason that I like the natural clinic is you can get antiviral solutions, nutrition and herbal protocols, but perhaps more importantly, constitutionalized or personalized approach. Now, we've all talked in this series about how there's a difference between 80-year-old granny that's shriveled up and Biff, the 20-year-old football player. And so the level of personalized medicine that's required to treat long COVID should not be overlooked. And so that's why, in many cases, a natural health provider is a better fit than a standard mainstream medicine provider. And here's the last thing I'd like to share with you. At the natural clinic, they may not have experience with long COVID, but there are many natural health providers that have experience in treating chronic fatigue syndrome, fibromyalgia, and in some cases, chronic Lyme disease. So they're used to treating chronic infectious diseases, and they can use what's effective for these conditions like chronic fatigue syndrome and fibromyalgia to help your long COVID symptoms. And so I want to just add by saying that's a great idea to see a health professional if you do have long COVID, but consider going to a natural health clinic. You also might consider going to an acupuncturist who also practices herbs. And the benefit is that you can get help right away rather than waiting 3 to 6 months to get help from the Western medicine clinic. If you'd like to see more videos like this, please be sure to like and subscribe. This would really help us grow our channel. Thanks for joining us, and we'll see you next time.